Welcome to the Well Project and Watch 2.0, session number 6. Can you believe it? We are 6 sessions in to our 7-session series. This one is Aging Positively, taking action across the lifespan. And it is our intention to address all of the issues facing women aging with HIV from literally across the lifespan of living with HIV. We all know that it is a process, and it is more than just a disease process. It's absolutely a life process. Are we ready to go to the next slide? So a little bit about the Well Project, if you're not familiar with us. We are a nonprofit organization with the mission to change the course of the HIV/AIDS pandemic through a unique and comprehensive focus on women and girls. And that is what we do. We do that through leveraging technology. Our focus really is education, information, community support, advocacy and leadership, collaborative engagement, and women-focused HIV research. And so just know that everything that we do, women across the gender spectrum are at the center and at the heart of our mission and how we do our work. Next slide. So our Watch 2.0 series is a treatment advocacy webinar series that was based on our very successful 2015 series, A Place at the Table. So this is 7 monthly sessions. This is number 6. Like I said, they're an hour each. If you return for all 6 of the sessions, we have a certification at the end that we're giving out for completing the series. And this episode is supported by a grant from Merck. Our next slide, please. So just a quick note on gender and language. And this is really, really important to us. We're proud to be a resource that welcomes and focuses on women across the gender spectrum. And that means all women who identify as such, as well as all people who can benefit from our materials and support networks. We not only acknowledge and affirm, but we celebrate the existence of our community members of trans and non-binary experience. The language that we use on our website and in our programs reflects this affirmation, and our commitment to grow is to grow stronger in this practice and more inclusive in our language. And we welcome comments to that effect, and we hope that you do feel affirmed as you join us on each of these webinars, and as you look at our website through the resources and information we have available. Next slide. So a little bit about our agenda today. So I've welcomed you into the space. We're going to talk a little bit about who is aging with HIV, sexual and reproductive health, preparing for aging well. We'll have time for Q&A at the end, and then we'll close this out. And so I sincerely hope you enjoy our webinar today. Next slide. So again, I am Bridgette Picou. I am the Well Project's Stakeholder Liaison. I love my job. Part of what I do is to kind of bridge the gap between clinicians and women living with HIV. I will be your moderator for today, and it is absolutely my pleasure to have with us today 2 powerhouse individuals in the HIV field and in this work. They have each unique perspectives to bring to this conversation. I will let them talk a little bit about themselves rather than trying to do it myself. And then once they're done, we'll jump into the session. So Marcya, why don't you go ahead and start for us? Introduce yourself, tell us just a little bit about you, couple sentences, so that the people know who you are.
Thank you so much, Bridgette. My name is Marcya Gullatte. I am a community advisory board member with the Well Project, and I've been working within the HIV community since 1995. You do the math. Oh, that's a perfect 30 years. I love this work because it not only have I been working, actually I've been working in it since before then. I've been living with the virus for 30 plus years, but I've been working in it since the very early 90s when I used to just set up tables at my college and pass out condoms and inform college students that they need to wrap up. This is a work that I'm very passionate about and I love. And I'm so honored to be here today. Thank you.
Thank you so much for sharing that little bit, because I think it's important to highlight that no amount of work, no effort is too small within the broader effort of HIV education and being there for community. So thank you for that. And then next we have Miss Antoinette Jones. Why don't you go ahead and tell the people a little bit about yourself? Are you able to come off mute? We were having a tiny little bit of technical difficulties earlier. So that may be what's happening. Give us a second here. We're going to work our way through it. You ready, Antoinette? We can't hear you if you're there. All right, we're going to stand by and work through that little bit right there. There you go. Is that you now? I can hear you, I think. Okay, maybe not. We're good. So we will work on that technical little snafu going on right there. And so let's go ahead and jump into our first slide, and then we'll come back and introduce Antoinette as she gets her audio going. Oh, I see you. Can I hear you now?
Can you hear me?
Hey, now we can hear you. Perfect. Thank you. So I knew you were coming, and we knew you were there. So thank you, thank you, thank you. Go ahead and introduce yourself, babe.
Hi, everyone. My name is Antoinette Jones. I am 30 years old. I identify as a dandelion or a lifetime survivor of HIV, which means that I was born with HIV. And I have been doing advocacy work for the past 7 years. I currently work as a national field organizer at Positive Women's Network. And I am also the co-founder of an organization called Dandelions, Inc. So I'm so happy to be here, and I'm sorry about the technical difficulties.
Girl, listen, Zoom is going to Zoom and technology is going to technology. Not a problem. We all here, we're present and able to keep it moving. So no worries. OG, ready to move us to the next slide? Speaking of OG, I want to give a shout out and ask everybody to do a virtual applause for Olivia Ford, who is our editorial director, who is responsible for all of the slides and information that you see on your screens. And she is amazing at what she does. And we definitely could not do what we do without her. So virtual applause for Olivia. And with that, ladies, I'm going to go ahead and turn it over to you.
Once again, thank you. Well, let's talk about aging positively. People living with HIV are living longer, fuller lives with HIV, longer than we ever expected. When I was first diagnosed and told I had HIV, they said maximum 20 years. Well, you see, that's a lie. Advances in HIV treatment have actually made it possible for people who are long-term survivors. And long-term survivors are those individuals who have lived at least 5 years or longer, and also lifetime survivors to live longer lives and more healthy lives than we ever thought. Okay, in 1922, in the United States, people ages 50 and over accounted for 54% of people living with HIV. And out of that, 16% of new HIV cases. Again, long-term survivors are people who have lived with HIV for as many as at least 10 years. And as I like the name Dandelions, that has been coined by the organization that Antoinette is co-founder of. because it comes from a part that is very special, and maybe she could explain that a little bit. But lifetime survivors, I like that too, because it's a term that has been come up by them, and it's much more respecting towards lifetime survivors than the names that we used to use. These are individuals who have been born with HIV, or who have been diagnosed at younger, early childhood ages.
Yes, thank you for that, Marcia. For a long time, I was considering myself a long-term survivor because that was the community that we were clumped into. And even then, we will get a lot of pushback because they will look at our age and look at how young we perceive to be and not really want to include us in those conversations around around long-term survivor. So just in like a small correction. So I do not take any credit for coining the term dandelion. And I would be remiss if I didn't honor Mary Bowman in this way as a woman who was living with HIV, as a fellow lifetime survivor, and a poet and an advocate in many ways. So her poem Dandelions really like spearheaded the thought process around we wanted to become a movement while we wanted to do like collective organizing. And I know we'll talk about this later in the slides, but I have to honor Mary in the sense of like the term dandelions in itself and why we see ourselves so reflected as a dandelion is because of the words that she spoke in that poem. Everything from the very beginning, from how she talks about her mother's experience to how she talks about her own challenges and issues navigating life. And so, yeah, I just wanted to share that. But we were never really included in the long term survivor conversation. So, community decided to identify as lifetime survivor. Um, I believe everybody was at a conference one time at a USCHA, and it came up in a room in a space, and that's where the term was coined, and everybody was like, yes, we are lifetime survivors. So, and here we are.
You know, Antoinette, I want to highlight the fact that you said that you all were lumped into a category with long-term survivors. And I think it's important to highlight that, you know, no matter where you come into HIV and no matter what age you come into HIV at, that you are coming in as part of a community. And sometimes it may be hard to find where you feel like you fit. Because, you know, I was diagnosed at 40 and I was too young to be considered aging with HIV or a long-term survivor, but I also was a lot older than, you know, many of the lifetime survivors. And so it's just really important that women recognize it doesn't matter how you come into it or what age you come into it. We all eventually are going to be aging with HIV. And so the things that come up are relevant to all of us. So thank you for highlighting. I think we're
Okay.
ready for the next slide, OG.
Thank you for that, putting that into the chat. I see that Olivia has posted the link to Dandelions. So living with HIV and living and aging with HIV, why are there health concerns around this? Well, individuals who are living with HIV are taking toxic medications. These medications over the years have effects, although they're suppressing the virus so that we are not being overcome with the virus and developing optimistic infections. I haven't said that word in a long time, but we're not developing optimistic infections. It still is playing a real part on the rest of our organs that have to process all of these toxic chemicals that they're going through the hospital. I mean, going through our bodies. So the potential for individuals to have more health issues is going to be higher. Lifetime survivors' treatment histories tend to be just as complex as those of older adults and long-term survivors. For example, some of the things that I covered that. Next slide, I'm actually on to the next. Oh, in the, thank you. Starting in 2023, no, did I go through all those slides that fast?
I think on this slide, Marcya,
Okay.
it's so important to talk about like the immune system of long-term and lifetime survivors. And I bring this up because like right now I'm dealing with a cold. And I have been dealing with this cold for probably like 5 weeks, more maybe. Um, and to talk about like how our bodies are different, and although we have like, you know, although we can live longer and healthier and more dignified lives in the words of PWN, um, we still have to deal with like the longevity of being sick, you know, so we don't recover as quickly as others who aren't living with HIV. This is why I sometimes do not like, you know, going to like conferences back to back or, you know, traveling so much because we don't give our bodies enough time to like rest and really like ourselves to recuperate. So, excuse me, I'm not sure if you experienced this, Marcia, or want to share anything around this, but like
Yeah,
the way that we experience common colds is so different.
exactly. It is. Right now, I'm recovering from a surgery to my neck. And even with myself, the recovery time just in that is going to be longer. A couple years ago, I had a surgery and they wanted to rush me out of the hospital, and they were expecting me to recover like a typical person after the surgery and release me the very next day. But because they were rushing me, I had more complications because they weren't expecting the differences that you would see in a person living with HIV for a long time. So I ended up spending 3 days in the hospital as a result. Additionally, people living with HIV are going to experience earlier onset of cardiovascular disease, kidney disease, diabetes, liver disease, bone disease. I acquired osteopenia, which is a prereq to osteoporosis, before the age of 50. It does. I don't also your eye disease. I went in 42. I started wearing glasses, and before I turned 50, I already had a cataracts surgery. So I mentioned that, and then also cognitive disorders. There, as well as other challenges, which are anxiety and depression.
I'm glad you highlighted like not just health barriers, but also like social and like mental health barriers that we encounter as well. I really resonate with the like um, heart complications because that's a major concern of mine as I'm aging with HIV, especially knowing so many other dandelions who have experienced heart attacks or, you know, heart failure at such a young age. Like that's something that we should be very concerned about, and there should be more research happening within our communities.
Absolutely. Thank you for highlighting that too. I think that the focus of heart disease should be more on women, right? They talk about men and heart disease very often. And a lot of times women get left out of that conversation, and we definitely need to be a part of it. So thank you for both of you for highlighting the kinds of effects that our bodies go through. I think we're on the next slide.
Awesome. So this will be my slide. So just wanted to share a little bit about Dandelions Inc., also known as the Dandelions Movement. I feel like we use movement because like we are a collective force. We're not just an organization. So we are trying to utilize our resiliency in order to create change and to move as one. So we were started in 2023. Actually, no, the world came to know about us in 2023.
But Dandelions was started in 2022, actually, by my co-founder and myself, Dorinthia, and I. And in Washington, D.C., we actually all got the opportunity, Dandelions and another organization called the Lifetime Survivors Network, got the opportunity to take the stage and to really demand our rights and our reason behind wanting to be included and have a seat at the table. The focus at the USCHA was Love Letter to Black Women. And I felt like that was really crucial for us to really take that stage during that time, because primarily the folks who are impacted by HIV, who identify as Dandelion or lifetime survivor, are and is Black women and Black people. As I mentioned, the spoken word piece, Mary Bowman, and the way that she talked about her mom's experience of living with HIV, one of the words, the sentences in the poem that she said was, um, if my mom could be seen, or if my mom could know that dandelions is just as beautiful as a rose. So that reminds us that as dandelions, as we stand, we cannot forget our mothers in this movement. We cannot forget the folks that we came from while we are on this journey. And then another line that she says is, she will lay her life on the line if it means that dandelions with unseen scars will not be seen as odd, but as gifts from God. That's bringing us into the community, into the conversation. That's bringing us in our older age and reminding, and even our younger dandelions, that we are here and we should not be left out. We should not be forgotten about. So, like I said before, like the entire poem just speaks volumes to why we are showing up the way we are, and why we are doing this work. We have lost way too many dandelions in the fight of HIV. Today we honor Mary Bowman. We honor Tiffany Marrero. We honor Hydea Broadbent. Like, we stand on those shoulders of those leaders, and who has sacrificed so much for our community, so that we don't have to lose anymore. So, of course, we came up with that list of crucial demands, and we are actually included. We have actually included them in our core values, which is, we demand safety in any space that we are in, the protection of our bodies. We demand respect. So, to acknowledge us as human beings, to acknowledge that we are not children anymore, especially the dandelions who are 40 years old, and older, like 30. I just turned 30 this year, and folks in community still sees me as a child and tries to put me in a child's place, so respect us for who we are and our experience. And then we demand love, like we lead with love, and we ask for love in return. So that's just like a little bit about who we are. I love that OG dropped it in the chat for anybody who wants to listen to the poem. Every time I hear it, I get very emotional, but also I encourage listening not just to that poem, but Mary's other poems as well. And we can go to the next slide. So when it comes to sexual and reproductive health, um, I had a lot of issues navigating sexual and reproductive health in grade school, K through 12 education. Especially when I got to middle school, it became very, very awkward to hear my teachers and my peers and the way in which that they talked about HIV, and being somebody who was sitting in the classroom living with HIV, especially in high school, like especially during a time when all you want to do is fit in, and folks around you are speaking negative about a diagnosis that you cannot control, like you were just born with. So older women do remain sexually active, as well as remembering that younger women are sexually active. We want to pretend and convince ourselves that young folks are not having sex, when in actuality they are, as young as 12 years old, and even younger than that. Young people are experiencing sex in a way where they don't have the proper tools and education or information at their disposal to make informed decisions. But when we are talking about older women, like the two communities who are often forgotten about, the younger generation and then the older generation, we only think that these folks in the middle are having sex, when that's not true. So many continue to date and return to following a partner death or the end of a long-term relationship. Many older and young women may not be aware of PrEP or other HIV prevention options, and then they may have to go through menopause and or not use condoms for birth control, um, even though condoms do prevent STI transmission at any age. So providers, it's important for providers to talk about sexual health with their 50 and older and lifetime survivor clients. My provider failed to do that with me. I think the reason behind that was because my mom would show up to appointments with me. So my provider never like took initiative to be like, hey, do you mind stepping out the room so I can talk to Antoinette? Like, so when you are in a doctor's appointment with your mom, are you going to talk about sex? No, like, not at all. You're going to deny, deny, deny. Even though, although I wasn't having sex, I was still, experiencing other forms of pleasure with my partners or with young people at the time. And I wish that my provider would have taken any type of initiative to, just have a one-on-one with me, because maybe I would have felt comfortable to ask more questions, or they would have felt comfortable to guide me around condom usage, around STIs, around what HIV truly means as far as when I become intimate, and even more than that, around disclosure. I never had any of those conversations with my providers, so I navigated throughout my teens until I became like 21, in which the conversations became more normalized. So GYN care is still important for women growing older with HIV. There should not be an age on GYN care. Sexual health care should include conversations that affirm women's sexual expression, and then respectful, safer contraception resources for lifetime survivors and other women at childbearing age. So the autonomy should be in the hands of the patient. You should not be trying to control the decisions that a woman or chooses to make when they are seeking sexual and reproductive health care. And Marcy, I see you wanted to share something.
I know we're looking at the clock, and I said I wasn't going to talk, and then I thought about the fact that oftentimes women who are in committed relationships don't think that they need to know about this information, and doctors need to be talking about it, and gynecologists and so forth need to be talking to all individuals, regardless of their relationship status or not, about this, because I know so many women who have been diagnosed, with HIV, and they were in a committed relationship. So it's important for any.
Amazing point, and it's really, really important. And I'm glad that both of you highlighted, number one, autonomy, and number two, Marcya, the need for women who are in relationships to be aware of their vulnerabilities, right? You know what you're doing, but you may not always know what your partner is doing. So thank you for bringing that into this space. And also in the chat, Krista has dropped a link to a fact sheet on that very thing. Back to you, ladies.
Thank you. Yes, Marcya, I remember just testing so many people when I worked at an HIV and STI testing and counseling clinic. And many of them would be in long-term relationships or married. And it will be their first time getting tested. And we will tell them, like, you can come in with your partner. You can come in at any time. Like, it's your decision. You don't have to wait until you find out that your partner is cheating on you to be like, oh, I should go get tested. No, just you want to do it for you and not for anybody else. So since we're speaking about you, it's important to know that sex is good for you. Like, sex is actually amazing for you. if you're looking to increase your mood, if you're looking to live a long, healthier life, have more sex. So pleasurable sex doesn't have to stop because of HIV or your HIV diagnosis or because you're aging. Aging and menopause may bring body changes related to sexuality, and you can learn to navigate while having a fulfilled sex life. Sex and pleasure is good for your emotional and physical health and can lead to lower stress, better sleep. Oh, sorry, the chat just popped up. Increased levels of oxytocin and so much more. I already mentioned like it's good for your mental, like emotional health, your mental health. But sex does not have to be uh, physical sex with anybody. You can have wonderful and fulfilling sex with yourself. And when I think of pleasure, oftentimes people equate pleasure to actually having sexual intercourse, when that's not true at all. Pleasure can be a myriad of things. Like pleasure can be you are like enjoying delicious food, you are taking yourself out on dates, you are taking a hot, warm shower and oiling your body afterwards. You are affirming yourself in the mirror and telling yourself how beautiful and good looking you look. There are so many things that equate to pleasure, and pleasure is really and truly what it means to you. Me and my friend was just having this conversation yesterday because I talked to my best about waiting till marriage to have sex. I was like, what do you think about that? Like, would you ever do that? No, like nothing against it because it's a journey that I'm willing and thinking about taking. And my best was like, I'm interested in it. Like, I would do it, but how do you think your partner will feel about it? So I said, I think my partner's on the fence about waiting till marriage. And my friend was like, well, why do you think that is? And I was like, I think pleasure is such a big deal in their life. Like for people who identify as men, like pleasure and sex is like, no, we have to check it. It's crucial to us. And I was like, I don't understand that. I was like, there's so many other ways to like find pleasure in just even having an intimate conversation with somebody that stimulates your mind. That's pleasurable. So pleasure in itself, I really would love for folks to think about like, what does pleasure mean to you? Um, and then like, how does it resonate, not just in your sex life, because sex is always good. We love it. But like in other areas of your life, what does pleasure mean to you?
Want to highlight in the chat that Melanie talked about anal paps when you have your GYN appointment, and that is critical. I was actually a nurse on a study related to HPV and anal cancer, and so for women, we need to keep in mind that even if you are not having anal sex, HPV is present in bodily fluids. And so just by virtue of the way that the body works in gravity, you do need to have an anal pap at least once or twice, just to make sure that you're checking up on your overall and total body health. So thank you for bringing that into the chat, Melanie.
I really love that Melanie said this, and I'm sure Marcya has some points around this too, because I actually learned to advocate for myself when it came to the anal pap from Marcya. And at my clinic, they had a study that they were doing around anal HPV and pap smears. And they told me that I was too young to be a part of the study. I believe that I asked to join it when I was like 25. And they were like, no, you're too young, even though I was already experiencing different forms of HPV. And I was like, I really think I should. Like, and they told me no. So it took years of me advocating and even like speaking to Marcya to go to them and to demand that my OBGYN not just do a vaginal pap smear, but also an anal pap smear, to make sure that I did not or was not at risk of not just cervical cancer, but anal cancer as well.
And when I say, after I say this, we go to the next slide. I appreciate Melanie for bringing that up, Bridgette and Antoinette. I just want to share that how I became familiar with it. I don't want anybody to have to go through what I went through. I had been diagnosed throughout the years 3 different times with cervical cancer. And so as a result, they did a partial hysterectomy. Well, I had 3 surgeries done in one day. And so when we talk about gravity shifting, well, you can imagine I had a lot of work done in the genital area, from the stomach onto the genital area. And then I started getting sick, and I was rapidly losing weight. I was just sick for almost over, it was for quite a while, for over a year. Went to a workshop, and as a result, they said that we need to be checked for anal dysplasia and cancer. And so I told my doctor when they were doing a colonoscopy, can you please check for check my rectal area too? And they said, oh yeah, we can. And the doctor never said they found anything. He just referred me over to an oncologist. And that's how I found out that I had anal cancer. But fortunate, because I did speak up and say something, they were able to remove it with just a surgical outpatient procedure. But this cancer is very serious because most people do not have that benefit, and they will have to wear a bag for the rest of their life where they poop out of that bag, or many people die. So this is something we need to take very seriously. I know I brought it up to a group of leaders who are living with HIV, and they laughed because they thought, oh, you were having anal sex. And I'm like, my sexual activities are irrelevant to what I'm trying to share with you. I'm trying to share with you something that will change your life and help you live a longer, more vibrant life.
Thank you for sharing that. That's really vulnerable to say on a webinar. And so thank you for sharing that and for stressing the importance of advocating for yourself. It is it's part of what we learn as we age, right? Even Antoinette was talking about advocating for herself and demanding what she wants. And I think that it's important to highlight that even though we shouldn't have to, and most of the onus should be on clinicians and providers, we do need to advocate and demand for the things that we want. And so thank you for sharing.
Okay, next slide is about perimenopause and menopause. Perimenopause is, thank you, Bridgette, is the transitional time that we are leading up to menopause. I'll tell you this, as a person who had a partial hysterectomy, it was far hard to identify because some things that are used to identify it is a change in the frequency of your menstrual cycle, the duration of your menstrual cycle, the amount that is coming out during your, then also there's hot flashes, night sweats, mood swings, depression. Well, mood swings, that happens sometimes. Well, I'll just say it's depression, but and irritability, those can be normal life events. Therefore, you also may have trouble sleeping, fatigue, and lack of sexual arrival, and skin changes. That list of things that could happen can also happen in other scenarios. So without the part that you have changes in your menstrual cycle, it can be very difficult. And if you are in this category, make sure you're bringing it up to your doctor at every opportunity you get so that they can catch it, because you don't have to go through it in agony. There are medications that can actually help with it. Menopause is a point where your body completely changes. I think it's one of the beautiful things, and it's also a difficult thing in life, because now for me, not having children would be great, and I love it. I can't have children, but one thing that also, well, menopause at some point, the period stops and will eventually affect all people with a uterus. That's a good point out, because if you don't have a uterus, that's not going to be affecting you. Some of the benefits that you can get that can actually treat it is hormone replacement therapy, complementary therapy. My mom used complementary therapy when she went through menopause, and it worked just fine. But I will say this, if you are on medications, prescribed medications, you need to let your healthcare providers know about the complementary treatments that you are considering before you actually use them, because they may have counter interactions with your medication and may be more harmful than they are helpful. Because when I looked up them, I found out for myself that one that I want to use was actually going to have negative effects on some of my medications. So taking these steps is to stay healthy.
Marcia, I'm so happy that you brought up the like any counteraction with medication that you are already on. And, you know, so many of our community members are not just on HIV medicine, but they may be on heart medicine or blood pressure medicine, excuse me, and other medications for comorbidities that they may be dealing with. So if they did want to take the route of, you know, identifying support for menopause, that is a conversation that folks need to have with their providers. Um, I also think it's not talked about enough. We already talked about like how lifetime survivor Dandelions age at a quicker rate because of being born with HIV. And the lack of research around our community. So we do not know the impact of us taking medications for long term, and how it has affected our bodies, how the medications as well as HIV has impacted our bodies, and will in the future. So how, because of the lack of research, this is just a question for the space. It doesn't need an answer today because we don't have an answer. That's the caveat to this question. We don't have an answer. But when a dandelion starts to experience menopause, how would we know? Because our body is already aging at a quicker rate. So how do we know that we won't experience early onset premenopause at a younger age than what is common for our fellow um, women peers? Like, how would we know? And some folks um, probably already have, but are not acknowledging it because of the lack of information out there. So this is just
Thank you.
yeah, this is just something that I thought about as far as like, you know, just being in community and recognizing some of the same experiences that, you know, my mom has experienced when she went through menopause that you are sharing today, Marcia. You know, our community, either we won't know or we're just like going with the flow of I guess
You
this
know,
is normal.
I really appreciate you bringing that up, Antoinette, because I've had the same questions too. I have a child the same age as Antoinette, and that's how I was diagnosed with HIV. I've had the question of how it has impacted life-term survivors because although my children are not living with HIV, I've always thought of it, they, it was a lottery. They could have been diagnosed, especially my daughter. It took 3.5 days of delivery. And I've always had, because of that, I've been very questioned about those who are lifetime survivors, about what can happen. And if we don't talk about the things that are happening in our bodies, then it's not going to be researched. When we first started talking about PrEP, it was only for men who are having sex with men. They weren't looking at heterosexual women. I recently had to get hearing aids, and I asked the question to my audiologist, have people been, he was very up on HIV, but he said there wasn't any research about it. But people in general in our society are very proud and they don't want to mention that their hearing is going. But you know these people who they are because they're speaking louder than what they need to speak because they can't hear themselves. They have their TVs up louder, not just because they want to, it's so they can hear. If you see people like that, encourage them to talk to their doctors about the hearing and not to be afraid to speak up. If we do not bring these things up, then the doctors and researchers will not know to research them. So whether they are, do lifetime survivors experience aging, that the symptoms of aging at a younger age? I bet you they do. But it's not going to be proven until there is research done on it.
Most definitely. Thank you for that. I think we're going to move into our next slide.
Okay, preparing for healthy aging, we need to monitor our HIV and overall health. A friend recently, well, a while back, mentioned that she asked to see a geriatrologist, and they didn't want to let her see it because at the time she wasn't even 50 years old. But yet she had a whole lot of health conditions that people 60 and over experience, and she wasn't 50 years old. So she had to push and push and push. And finally, she's able to see a geriatrologist, which is a type of doctor that looks at aging. They specialize in aging. And that is very important for all of us. I still have not been able to get that doctor myself, but I really would like to look into it. You need to have regular checkups and dental visits. Many times we skip our dental visits because we don't like sitting in that dentist chair. We also may skip it because Medicare, straight Medicare, does not offer dental coverage. For whatever reason, we are not getting the dental care that we need. We need to find avenues, because if you don't keep up with your dental care, it can lead to death. Yes, I said death, because it can affect your body. Your teeth, the roots in your teeth, they get down into your system. And I'm not a medical provider, so I'm not going to get detailed with that, but it's very, very important to stay up on that. You need to learn about important vaccinations and screenings. I just had a recent visit and I went through the list. I said, where am I? Am I up to date on this? Am I up to date on that? Make use of your time, because that time when you're in a doctor's office is your time and you need to make the best use of it. Don't let them check their boxes and be done with it. You check off your boxes and go in prepared. Having a great relationship with your provider is also really good to help you. I have an incredible relationship with my nurse practitioner. So it's funny because I had not even met her, but I had communicated so much with her in the portal that we both felt like we knew each other very well. So when I started having cardiovascular health issues, she trusted me and sent me to a cardiologist, because my family history is way loaded with people dying at age 53 and younger from heart attacks in their sleep. That type of relationship is invaluable. It could be the difference between life and death. I know so many people in my own family who are deceased now because they did not keep up with that. You need to keep up with your mental health and stay physically active too. Watching TV is not going to stimulate your mind unless you're watching something that's going to make you actually think. But reading, doing puzzles, and other things like that is going to be very beneficial. Exercising, just a walk right now. I just recently had surgery. I need to go take a walk, even if it's just around the block or it's half the block. I need to do that because it's going to help in my recovery from my surgery, but it's also going to help you stay healthy as an individual or anybody who is living with HIV or lifetime survivor of HIV. You can also look into weightlifting and swimming. I was recently in a exercise study for people living with HIV, and I was able to lift more than I ever lifted in my entire life at the age of 54 because they kept on pushing me. And I was so proud of that. Now, unfortunately, that ended because I had a car accident, which led to the surgery. So I've got to get back up there. But if I did it once, I can do it again. And that's what we need to keep on telling ourselves. If I could do it once, I can do it again. If I've never done it before, then it's a challenge to try and get there. You go at your body's pace, but don't stop doing it because you're feel tired. That feeling of tired, those few aches and pains, that's your body actually getting healthier and starting to rebuild itself. If it's too much and it's excruciating pain that doesn't go away, contact your doctor. So pace yourself. If you have health conditions like COPD, converse with your doctor before you actually go in to exercise in a gym and stuff and see what you can actually do and make sure you stay on track. But do something is the most important part about it. Don't just sit around. Their lady at the hospital once told me, she said she marched in place looking south, east, west, and north 10 times. When that got too easy, she started marching in place and added the numbers till it was like in the hundreds. She dropped, I think she said 20, 30 pounds just doing that, just marching in place
That's
right before she went to
amazing.
bed.
That's
So,
amazing.
yeah, we need
Thank
to focus on the benefits that will benefit our body, our minds, our bones. When I found out that I had osteopenia, they are wondering why it hasn't spread to osteoporosis. Well, I started taking large doses of calcium, magnesium, and D3. By the way, all people of African heritage typically need to be taking D3. I don't know the medical terms of it, but I've been told that that's an area where we may be lacking. So we need to increase that. But since I've been doing it, it has not, my osteopenia hasn't gotten better, but it also has never progressed to osteoporosis. Yes, Bridgette, it looked like you were about to say something.
Yeah, I was going to say thank you for bringing that up. It's an important conversation that folks should absolutely have with their clinicians when it comes to vitamin D and also vitamin B12. I want us to be conscious of time. I know we have a couple more slides left. So yeah, I don't know if you're next, Antoinette, but let's jump into the next slide so that maybe we can have a couple minutes for questions too.
Yes, so it's important to connect with social support. I grew up very isolated, so finding and identifying community was truly important for my health, my mental health. Once I actually found the first person, the first woman I met who was living with HIV, I felt like I could live, I can thrive. And then the same thing when I actually met my first dandelion, who was, of course, older than me. It just gave me the sense that, oh, wow, I can live until I'm 28. And now I can live until I'm 30. And now I can live until I'm 35. And then recently meeting someone who was 42. And I'm like, oh my gosh, I can live till I'm 42. So having that connection with community is truly important. It reduces isolation, it increases a sense of safety. You build community in person and online, and you can include anyone in what you consider your sense of community. Sometimes people don't have family and friends in their personal life who support them because of their HIV diagnosis. But the community of peers who are living with end up becoming your family, your closest family, your spiritual family. So they still mean just as much, but you want to build your community network. And then, yes, a pet. I have me an emotional support animal. I just got her, I rescued her off the street. Sometimes I want to put her back, but I look at her and I'm like, oh, I need you. Um, that's my little cat. Her name is Sugar. So consider having a mental health counselor, a health educator, or a peer counselor. My therapist means so much to me. If I can call her a friend, I would, but I know we have a patient provider relationship. But she just means so much, and she has helped guided me through this journey called life for the past like 6 months. And I got to call her when I get back home to schedule my next appointment. But then also in exploring body positivity and self-love. That's truly important. Like I said earlier, affirming yourself in the mirror, maybe writing affirmations on the mirror or on little sticky notes. I leave my sticky notes around my laptop. I leave them on my walls, on my mirrors. I leave them everywhere throughout my house because that gentle reminder is truly important when you are navigating life and just need that little pick me up to get you through the day. Next slide.
Let me jump in here real quick. Sorry, Antoinette, because I know some people are going to have to go. Really quickly, if you could just click on the link that Krista dropped into the chat, which has our evaluation. If you can stick around for a couple minutes, please stick around for a couple of minutes. If you have to go, please take the evaluation. It helps us tremendously with our programming so that we know we're headed in the right direction. And if you have to step off, thank you for joining us. We are still going to go ahead for the next couple of minutes, get through these slides. So you're welcome to stay, but please do take the evaluation. Go ahead, Antoinette. I'm sorry. Thank you.
Thank you. Thank you, Bridgette. So creating an aging plan is truly important. I actually didn't think about something like this until I until I connected with community and started to lose folks within community and having to organize like services and like burial plans for them and things like that. So allow for more thoughtful decisions and even conversations about where and how you wish to age and reducing your stress in the process. So discussing that plan with your family and friends is really important. And I will add here, even your peers. So even folks within your network that you are close to, letting them know. I have my ace boon coons who are like living with, and I will make sure that they know so that if nobody shows up for me, I know that they will. Consider doing it sooner rather than later. And your plan may include your care planning, long-term care for insurance, legal documents, power of attorney and health, financial checkups, and building a safe home environment. And you can go to the next slide. So women surviving and thriving over a lifetime with HIV, like we mentioned throughout this presentation, there needs to be more research when we are discussing issues related to early acquisition of HIV. I have a peer, I'm wearing pink today because she's on my heart and my mind. I usually wear my breast cancer earrings. I mentioned her name, Tiffany Morrell. Nobody would have believed that she died from breast cancer in her 30s, her early 30s. And right now the recommendations are, I believe, 45 or around 45 to screen for breast cancer. And that was just reduced about 2 years ago after her passing. So it needs to be reduced even lower when we are talking about folks who have been living with HIV for a lifetime. Acquiring comorbidities could happen quicker for us because of the longevity of HIV and what it's doing to our bodies. Lifetime survivors, we need spaces to connect. We need spaces to thrive. We need spaces that are ours. We need spaces to have those conversations about what's happening to me. Is it happening to you? Because research is not out there, and that's the only time we actually get to really discuss the commonalities within our bodies and us aging with HIV. And then, of course, listen to women who have lived with HIV their entire lives and figure out how to thrive. My mentor, Marcya Trailer, made a comment that I would always abide by is if we start to look at people who were born with HIV, when it comes to their HIV diagnosis, we will ultimately know how to tailor our support for those who are 50 and up. Our bodies are one and the same age. Just because we are younger, the way HIV is working in our bodies is very similar to those who are older adults who are aging with HIV. If you look at both communities, you will see a lot of similarities in what is happening. And we will possibly get to better research findings, better solutions, if we start paying a lot more attention to the lifetime survivor community.
That's a whole word you just said. Let's highlight that, because what it comes down to is each one teach one. And on that note, our next watch is number 7, and that is going to be related specifically toward science and research for folks living with HIV. So do join us for that one.
Thank you, everyone, for this opportunity and for sharing space with us. You can follow the Well Project on all of their platforms by clicking this link or like scanning it with your phone, because we are fancy in our ways. And then I just want to pass it to Marcya to say their farewells.
I want to thank everybody who was able to attend and those who had to leave for being here and supporting us with this. I hope that you could make the next one and continue to support Watch 2.0. I would also like to thank each one of you for the comments that you made. We may have not commented on them, but I guarantee you I saw all of them. And I heard you and what you had to say with being diagnosed early with different things and how things have affected you. So I really want to appreciate that, because all of that is beneficial to keeping this conversation going. Thank you so much. And I hope you all have a wonderful day.
Thank you so much for your time, Marcya and Antoinette, and your wisdom and your insight. And conversations like this are so important because not only does it bring community together, but it brings all of our perspectives into the same space, and that we can recognize that we are more alike than we are different. And our common experiences make such a huge difference in how we interact and how we grow and learn from each other. So thank you all for being here, being a part of the webinar, for sticking through to the end. If you were able to, please, 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 once again, take our evaluation. It is in the chat. The slides will be available within a week. We will repost for those who should be here and who aren't. Remember to share it. Each one teach one, each one reach one. Join us next time for number 7, which will be, like I said, on science and research. And please go forth and do wonderful things. I know we are in rough times right now, but if we stick together and hold each other's hand, we will get through it, because that is what we do as a community. We get through things. So thank you again for being here. Thank you for joining us. We are signing off.